Hi everyone, I'm Dr. Sharita. I am your board certified emergency medicine physician, healthy lifestyle enthusiast and educator. I am an Amazon best-selling author. I am a renowned public speaker, media personality, and podcaster. And I just wanted to jump on today and just quickly go over some coronavirus quick facts. Just to, again, keep you up to date with the latest information and keep you in tune. So thank you so much for joining me. I wanted to first start off by talking about the effect of coronavirus on young people. Now, previously we said or thought that it was only mainly affecting those people who were older or had compromised immune systems, but we now know that young people are being affected just as much. And so, again, we just want to drive home that point that you as a young adult are not invincible. You are at increased risk as well, even if you're young and healthy with no underlying symptoms. More and more cases are coming up. As more information is being learned, we are adjusting our recommendations based on that. So the initial information came out of China, where a lot of their severe cases were mainly in older adults or people with underlying illnesses or poor immune systems. Here in the U.S., we have a high percentage of young adults who are becoming infected. So it's time for young people to take it seriously. It's time for you to press upon a young person or a young adult in your family to take it serious. So that's no more quarantine parties. I actually had to talk with and get on my daughter about a quarantine party her and her friends were, planning last week before they actually ended up shutting our city down. Because it's not a thing. It is not a thing. Quarantine parties should not be taking place, right? You should no longer be visiting your friends. I know the kids are out of school. My youngest daughter is going crazy because she would like to go and visit and play with her girlfriend, or have her come over here. But I had to tell her no, because we should be practicing social/physical distancing. Because young people, what ends up happening, you might feel young and healthy and invincible, but you become a carrier and you pass it to someone else who their immune system may not be as strong, or their system may not be able to fight it off to that degree. So again, very important to keep that in mind. Realize that you are not invincible. You too can be a carrier, and you too can be stricken with the severity of the disease just like anyone else. It's kind of hard to say because all of this is still new and we are still learning new information as we go along. It's just better to take heed to the necessary recommendations and continue to do your part in maintaining social distance, physical distance, and that kind of thing. Because again, asymptomatic carriers end up taking it into their household and infecting grandma, grandpa, maybe your neighbor, maybe your family member, maybe even your coworker. So again, it's very important that we be socially responsible to do that. Secondly, now what is an asymptomatic carrier? Well, we do know that we have an incubation period. And an incubation period is that time from when you are exposed to or infected by the virus and when your body starts manifesting symptoms. So they say it's about 2 to 14 days with this new SARS-CoV-2 coronavirus. However, on average, about 5 days after you've been infected with the virus, you start manifesting symptoms. Again, most of the symptoms are mild, but it just depends on how aggressive that disease will affect the individual. Everybody is different, so these are some things to keep in mind. But that's the incubation period, okay? So an asymptomatic carrier, they took the data out of China, and China noticed that 30% of their cases were actually asymptomatic or silent carriers, which means they tested positive for coronavirus, but they had no symptoms, right? And they were able to get this information because they actually did blanketed testing. So they tested a good majority of their population. They had numerous testing sites set up, and they did these tests free of charge. And so that's how China was able to come up with a lot of the information that we are able to extrapolate and use here in the U.S. that gives us some of the recommendations that we are giving to you. As a result of their blanket testing and the data that they got based on their social isolation, their city, statewide lockdown and those kind of things, the actual number of cases for China, new cases, is decreasing. It's actually going down based on social distancing and lockdowns and all the other things that we're asking everyone to do here in the U.S. And then, if we get on board with this, then maybe too, our cases will start declining. But we have to be responsible and do our own part, right? So, coronavirus testing. Well, who was actually tested? So, not every cough, cold, runny nose is due to the coronavirus. Okay? Yes, you have to keep in mind that it is allergy season. Keep in mind that people are still getting the common cold. Keep in mind that people are still experiencing the flu, influenza, right? So not every cough, cold, or symptom like that is coronavirus. However, there are testing sites that are set up, and they have different protocols based on your state or local guidelines and recommendations, right? So those with symptoms and who believe that they've had contact with someone who was infected, they'll be tested. People who have had symptoms and visited a high-risk area, those people will be tested. And people who are febrile. Now, some cases, some states won't test you unless you're febrile. Others will have a lower threshold. And these are those tents and those drive-up and drive-through testing sites. A lot of times the emergency departments may have a lower threshold, but again, it's dependent on whatever protocols they have put forth. And just because you show up saying I have XYZ does not mean you're going to be tested. Keep in mind that there are a limited number of tests that are available, and they can only test so many people a day. Now they're gearing it up and trying to get more and more tests and more laboratories available to be able to run these tests. But again, it's a work in progress because we just got hit with this at onslaught. But we definitely need to hopefully get to the point where we can practice like China did and do blanket testing so that we will actually have a better idea of what's going on with this coronavirus, right? Ultimately, the decision for you to get tested is up to your healthcare professional. So just keep that in mind. So how is the test done? So you go up, you pull up. Now we do testing by way of a Q-tip, cotton tip swab. It is either put in the back of your throat or nasopharyngeal, which is up through your nose to the back. It is twirled around or put up in there and twirled around for about 10 seconds to make sure that they get a great sample, right? I've never had it done, but I hear that it's very uncomfortable. So while you're running up there trying to get the test done, please understand what you're getting into, okay? Because it is quite uncomfortable. And no, there's not a treatment, but the test does give us information and data that we can use to extrapolate on checking the patterns of the disease, those vulnerable populations, the communities where it is, various things like that. So just keep that in mind. But okay, the test is done. It's put in the tube and sent off to the necessary labs. The test usually takes about 5 to 7 days to come back and get your results before you're called with your results. However, they're getting a lot more tests done, so it may be a little, lag or backlog with getting those results. But as soon as your healthcare provider or their testing center gets the sites, then they will definitely reach out to you. Not get the sites, gets the results, then they'll definitely reach out to you and get that into you. Now in China, they actually use what is now a rapid blood test. And that's where they do more like a finger stick like we would do for blood glucose here. They have that over in China where they're actually able to tell if a person has been exposed to the coronavirus by way of testing or looking for antibodies. And our body builds up antibodies after we've been exposed to a virus, kind of as an immune response, sort of. So they're working on that kind of testing here so that we can, again, start getting that rapid test done and getting results back sooner than, 5 to 7 days. Keep in mind, too, that a negative test does not totally rule you out for a variety of reasons, depending if they didn't get an adequate enough sample. So patients who pull the nurse's hand or pushes it away or yanks away and all, you can't get an adequate sample, then when they send it to the lab, it may come back negative. But again, that doesn't rule you out. If the transportation medium for which the sample was transported, if there was some problem there, for a variety of reasons, you can get a negative test. However, you don't need to have that repeated unless your symptoms continue to worsen, right? So you don't necessarily have to run back unless they've said, oh, well, maybe it was a lab error or your symptoms continue to worsen. You want to make sure that you are getting these tests done at a reputable testing site. Okay, don't fall for the coronavirus testing scams. They have a lot of online tests that are being sold that are not FDA approved. Don't buy those. You have do-it-yourself coronavirus testing at home. Don't buy those. Those are scams, waiting and willing to play on your vulnerability, and they will not give you adequate or trustworthy results. So definitely either go to a hospital or a designated testing site where if you called your local health department, they would let you know those sites that are available. Your healthcare provider will let you know, what needs to be done. So what should you do if you get sick? You're having cough, cold, you might have a fever, you might have chills, headache, body aches, nausea, vomiting, diarrhea. But you may not have COVID. But what do? You stay at home. You stay at home and you call your doctor, right? Call your doctor. They'll screen you, ask you all the appropriate questions, and determine what your next steps should be. So they'll advise you if you need to go to the doctor. Go to the testing center. Or they'll advise you if you need to come in to see them or tell you to go to the emergency room. Right now, a lot of doctors are doing telemedicine visits. So you may not even have to come into the office. You might be able to do one of the drive-up testing sites if they send you out for testing, and then you can do a telemedicine visit with your physician, talk to them about it. That way they get a chance to look at you kind of face-to-face and see, how you're looking and what's going on there, and kind of do somewhat of an exam to determine what the next best steps will be. You also can call your local health department, and again, they would tell you where those testing sites are if you meet the criteria to go and get tested, because they're not testing everyone, okay? You have to meet certain criteria, but when they do, then you can, that option is available to you. They will also be able to help you determine when you can come off of self-isolation or quarantine. So let's talk about that. Self-isolation versus self-quarantine. Well, self-isolation is when you voluntarily elect to stay at home and isolate yourself, right? It is when you have or most likely have COVID-19 or coronavirus infection. You usually are experiencing mild symptoms, usually at the advice of your primary care physician or healthcare provider. They'll advise you to isolate, self-isolate. If you have symptoms and you're waiting on your test results to come back, then they'll tell you to self-isolate. If you have been exposed to someone who has COVID-19 and you start experiencing symptoms, they will have you self-isolate. And usually this lasts as long as you have symptoms and until they resolve, or until you get a test that comes back negative. So usually, and once you've tested positive, they'll keep retesting you until you test negative. So that's self-isolation. Self-quarantine is usually done for 14 days, and it's done by the family members of someone who is infected with COVID-19. Right? So if they have COVID-19, they have symptoms, then self-quarantine is done by the family, where then you are instructed to stay in the home and not go out for 14 days. It's a safety measure, right, to protect the rest of the public, to keep you, even if you may have symptoms or you may not have symptoms, but you might be that asymptomatic carrier, it keeps you from spreading it on to someone else or putting it out in the public. So definitely stay at home, right? And again, this is based on your physician's recommendation. So what do you do if you test positive? You've got the test, your doctor calls you back, they tell you your test is positive. What do? Well, again, you stay at home, you self-isolate, and you only go out for medical care. So that means you're sending someone else to the store to run your errands. You're sending someone else to get your groceries and your necessities. You don't go out. While in the home, you wear a mask. So you're covering yourself, you're keeping your cough, your sneeze, you cover that either with a mask or you cover it into the bend of your elbow, your cough, your sneezing. You separate yourself from animals and people in your home. So this is where that self-isolation comes into play, so that you don't get them sick. You separate yourself from them. You want to make sure you're washing your hands often. You don't want to share personal household items. So those are things like your plates, your forks, your cups. You don't want to drink after anyone who was tested positive or anyone you suspect may test positive. So you want to make sure you're washing those dishes quite regularly, but you keep those separated from the rest of the family. Make sure that you continue to disinfect and clean your high-touch surface areas in your home. Well, I'm sure we're all doing this anyway, right? Because we're trying to prevent the spread. And you want to monitor your symptoms. If at all your symptoms begin to worsen and you've talked with your doctor, you want to make sure that you call before visiting your doctor. But if they give you that advice that you need to come in, or you yourself know that your body is not responding in the way you think it should, when you feel the worst, then you go on in, you go see your doctor, or you go on into the nearest emergency department. That's if you happen to test positive for coronavirus or have COVID-19. You want to make sure that you are monitoring your mental health. During all of this, it's definitely a stressful time. It's stressful for all of us, right? Make sure that you're monitoring your mental health. This is unfortunately our new normal for now. But I think the sooner that we all get on board and start doing what we need to do, doing our part to physically distance, to continue to disinfect, to flatten the curve, to slow the onset of new cases, the sooner we do that, the sooner we can get back to perhaps our normal way of life. But it's going to take a village. It's going to take all of us doing our part. And unless and until we get on board and do that, we could be in this for the long haul. And nobody wants that. So anyway, back to it. It's very stressful. When we're doing lockdowns in certain cities or social isolation or distancing, right? It's so isolating and even depressing. And some people handle it better than others. But, that being said, we all have to monitor our own mental health. We are unfortunately at risk for those addictive or bad behaviors. So things like, drug use, alcohol use, emotional eating, overeating, hypersexuality, you name it. I mean, we're at risk for it because, when we are depressed, isolated, feeling down, anxious, mad, confused, right? We tend to engage in those behaviors that make us feel good, though they may not always be good for us. So again, just keep in mind, remember to exercise self-care. You got to take care of you. You can't take care of everybody else if you don't take care of you. So exercise self-care, and that's whatever that means to you. If you need to take a moment away, if you need to get a massage, if you need, get your family member to massage you. The kids at home, make them massage you, shoot. Right? Because this homeschooling thing, that's a whole nother thing. God bless the teachers and educators of the world. Because, but make sure that we continue to talk about what we are feeling. Talk about your feelings. Let somebody know. Call up a good girlfriend, a good boyfriend. Talk to your mate, your spouse. If you live alone, reach out to people. And for those of us with kids, don't forget the children. Because, it could be confusing for them. They may not understand, well, why do we have to do all of this? And what is this virus? Or they may be watching the news, or it might be on the television, and they don't quite understand how to process it. So talk to your children. Make sure that they are allowed to tell you how they feel. A lot of times they might think, well, okay, it's a vacation, I'm out of school. But it's much more than that when, they can't go over their friend's house, can't have the friends come over and do a sleepover. It's not a big slumber party and that kind of thing. So very important to talk about your feelings, put it out there, talk with your kids, make sure they're able to do the same. As I said, stay in touch with your family and friends. We got FaceTime, Zoom, phone calls, texting, whatever mechanism that you use, just make sure that we continue to stay socially connected, even though we are isolated and quarantined away for right now. And you can reconnect with those people within your household. Reconnect with your family. We have gotten so caught up in the busyness of every day that this is allowing us time to come back home to roost, right? And so play games with your kids, Do a family project within the home. Cook a meal. I've had my kids in the kitchen because I love to cook. So cook a meal with them. Help them bake a cake. We made banana nut muffins yesterday. So different stuff, whatever you're interested in. Do a scrapbook. This will be a great time to maybe do a family scrapbook, and everybody can contribute and do their part based on what you have in your household. You can do cleaning. Spring cleaning, that'll be a great thing, I'm sure, to the kids' dismay. However, again, this kind of behavior helps break up the monotony, it breaks up the boredom, and it makes us feel more connected. You want to make sure, too, that you are eating healthy. As I said before, we could quickly fall into those bad habits of eating all the wrong foods. The grocery stores are stocked and full most times of things that are healthy and good for you. So when you go, make sure you're making the right choices and choosing the right foods to keep your body healthy and fed and energized, so that we can keep your immune system strong, so that if you happen to come across the virus, that your body is able to fight it off and you only exhibit mild symptoms. Because as I said, 80% of us will get it, but only exhibit mild symptoms. Excuse me. So again, just keep that in mind. Make sure that you're getting enough sleep. Okay? Make sure you're getting enough sleep. I know it's stressful. I know it's hard. A lot of people are up. Some people are glued to the TV, watching it all night. But make sure that you're getting enough sleep, because that also helps to boost your immune system. It makes you feel refreshed and energized in the morning, so that you are prepared to take on the next day, come what may, right? We want to make sure when we're monitoring our mental health that we continue to do our part. If your state has initiated a stay-at-home initiative, please abide by it. Please stay at home, save lives. We physicians and healthcare workers are out here on the front lines. We're working to keep you safe. We're working so that we can help those people who have become infected with the disease, or who've come down with severe symptoms. So we want to make sure that you continue to do your part. Don't go out and be cavalier about it and get exposed and come down with the virus, and then where's the first place you're going to run? To the hospital. Do your part, stay at home, stay safe, don't get sick. To the best of our ability, at least, right? You want to make sure that you continue to clean and disinfect. You want to wash your hands frequently. You want to wash your hands with soap and water for 20 seconds. You want to use alcohol-based hand sanitizer. Again, cover your coughs, wear your mask if you're in the home and you are sick. To me, I've seen people out in public with masks on. I've seen people with gloves on. Okay, here's the thing. Now, if you're sick and you're out and you have on a mask, you shouldn't be out. You should be at home. You should be at home. If you're out and you have a mask on, as I said before, I don't know that it's really helping, but for us, we all feel so lost and helpless that we look for any way that we can have some control over the situation. So for some people, that makes them feel in control. And that's fine. But again, keep in mind what you're touching. So I've seen people with masks and gloves, right? So I'm at the grocery store. People come in there with these gloves on. You know, they get the wipe, they disinfect the cart, but they might disinfect the handle. They don't disinfect the whole cart. Then they're walking around the grocery store with these gloves on, touching everything else. Keep in mind that whatever you touch is now on those gloves. And unless you're changing gloves every time you touch an item that you're putting into your basket, you could possibly have contaminated that item. So you want to be mindful and perhaps wipe down those items that you have now touched with those contaminated gloves that you are now bringing back into your house. So just food for thought, and that's just my opinion. I think you would serve better to disinfect the cart, take your own wipes with you and disinfect it, disinfect your hands, and then wash them after you've left the grocery store. You know, it's you can get kind of caught up in all of the disinfect this, disinfect that, but, you know, I'm just saying, that's just my opinion. I think, you know, we need to be more mindful. And I don't think that wearing the gloves will necessarily help you per se. Because people have a tendency thinking that it gives you a false sense of security where you have the gloves on so you're not touching anything. But you're touching everything and you're recontaminating different surfaces. So just food for thought. You want to make sure that you stay up to date from reputable sources. Reputable sources. Don't believe everything you see on the internet. Don't believe every video that somebody sends you. Just don't believe it. Every email, every post. Make sure you're getting your information from reputable sources. Okay, because everything on the internet is not necessarily true. All of the home remedies, all of the gadgets, all of everything. It's a lot of hype. Unfortunately, there's a lot of scamming going on. There's a lot of people who are out there vulture-like playing on people's emotions. So don't get caught up in that, right? I just say, let's hang in there. Let's all hang in. We're all in this together. And if we continue to do our part, we will make it through. We're going to make it through. This won't last forever. But we have to continue to do our part, right? So that's all I have for you. I didn't want to keep you too long. I just wanted to come in and give you those little tidbits. Until next time, I want you to stay safe and be blessed. I'm Dr. Sharita, and you can find me on all social media sites at DRSharitaMD. I have a website, www.DrSharitaMD.com, if you like more information. Thank you all so much. Stay home, stay safe, be blessed. Bye for now.